This presentation is on postnatal changes and how a woman's body has to adapt again post-birth, with changes in the soft tissue in context to the abdomen separation that we know as diastasis or DRAM. So the female body has an amazing ability to then recover again after giving birth. Dr. White has already covered some of these physiological changes that occur within hours of giving birth, such as the uterus contracting to stop the bleeding from the placenta, and then the uterus shrinking within hours to the level of the belly button. Breast engorgement that happens for milk production, beginning within 24 to 72 hours after birth, then adjusting to the baby's hunger requirements. Any bony pelvic joints that have needed to widen for birth, such as the pubic symphysis, takes a bit longer to return to baseline by roughly 12 weeks post-birth. And alterations in the spine alignment readjust over a couple of months, but muscle adaptations to the weakening and lengthening take longer to recover. It's also important to remember that our new mothers are doing different functional tasks, which often involve a lot of bending over for feeding, nappy changing, lifting babies in and out of cots and car seats. And it's often not long before any sibling toddler that can easily weigh 15 kilograms or heavier demand to be carried, or the mother simply needs to lift heavier objects such as car seats or prams in and out the car. So I just want to highlight to not assume, as childbirth is a natural process, that it only requires a natural recovery. In fact, there's no specific rehabilitation guidelines that currently exist for postnatal women recovery, and musculoskeletal health has largely been unstudied in this population. Most academic papers in this area are starting to come out, but looking at athletes or return to sport. And the papers are only giving general guidance at this stage for continuous assessment of the changing body in the postnatal period as women return to daily living, exercise, work, and sport participation. So providing an insight to how soft tissue adapts postnatally is through the closing of the gap of the rectus abdominis, also known as the diastasis or DRAM. We're interested in both from a functional and an aesthetic point of view. Now we know that a true diastasis is defined closer to 3 centimetres. We're interested in functionally if anything of a bigger gap impacts trunk stability or pelvic floor disorders. Body image is also a valid concern, with media putting lots of pressure on women's ability to return to pre-pregnancy bodies, portrayed with the flat tummies. As Dr. White has presented, we know estrogen levels drop significantly after birth and remain low during the postnatal period with breastfeeding. This table demonstrates the influence of estrogen exposure on just 2 collagen types, type 1 for tensile strength and type 3 for elastic recoil. These 2 collagen types are important in the context of looking at abdominal adaptation, allowing for the stretch, for the accommodating the growing baby, and then post-pregnancy when it rebounds, if you like. So in the first column, showing the follicular phase during menstruation, there's approximately the equal ratio of type 1 and 3 collagen. In pregnancy, where the estrogen exposure increases by 30-fold, there's an increase in elastic recoil in the collagen type, where a decrease in the tensile strength, allowing for the expansion of the tummy. Post-birth, during breastfeeding, you'll note that the estrogen actually drops below a menstrual level and the collagens switch. So an increase in tensile strength as the body recovers and a reduction in the elastic recoil collagen type. So we know our tissue type, specifically collagen, adapts due to hormone exposure. And the recovery in the diastasis shows it takes approximately 8 weeks to allow the elastic recoil collagens to change to the higher ratio of tensile strength collagen type. In context to exercise guidance, it is now thought that full recovery of the abdominal wall is closer to 6 to 8 months postnatally, following either a single or multiple birth. This might seem like a long time, but in context to an ACL ligament injury that can easily take 9 to 12 months, it seems more reasonable. Overall, it's important for personal trainers to move towards general abdominal training in context that mum needs to bend over and pick things up. But checking in with correct breathing during exercise is vital, with ensuring no breath holding, using exhale on effort, particularly in the early days, with that connection to the core, tummy, and pelvic floor. The client always taking a lead on what feels right, and any concerns refer back to medical or the pelvic health physiotherapist.